IVF for everybody gives you a greater chance of getting pregnant. However, it's really a snapshot at 1 month.
Yes.
So when people try to get pregnant and they try January, February, March, why is it that March they got pregnant and not January, February?
Yeah.
Right. And so that's what IVF is, which is hard to hear because it's, it's challenging for some people physically and mentally, and for some people financially burdensome.
Sure.
But that is why people end up having to do more than one cycle.
Right, right. Well, that makes a lot of sense. And I think when you explain it that way, it's easier to wrap your head around it and accept, that you may have to do multiple cycles and that each cycle is like unique, right?
Yeah. I mean, I've had patients where they did one cycle and I think a lot of people think it's only a numbers game. Numbers matter, right? And numbers help when talking about statistics, but there's a lot that's somewhat up to chance because we can't, again, the egg is microscopic. When we go in to get it and when we're doing ultrasounds, we can't see the quality of the egg until we take it out.
Right.
So
Right.
I've had patients who had a lot of embryos and not anything was normal, and then they made embryos, maybe a smaller number, but then they did have some normal embryos. So
we know from the data analysis and from our personal experience, right? So stress level, okay, shortness of the sleeping, okay, especially like night shift and not that clean diet. All of these things cause the chronic inflammatory situation. And from the clinic practice, I see both PCOS and the endometriosis patient, they are just the mix of the situation. They are not homogeneous, especially my experience for endometriosis patient. You saw some endometriosis patient is a quality issue, some is implantation issue, some are both, right? So we saw this kind of patient benefit from the acupuncture, from the clean diet, from the lifestyle change.